Joining us right now is CNBC senior health and science reporter Meg Terrell. Also here, Dr. Aditi Nerurkar, physician at Harvard Medical School. So, Megan, we're going to start with you. Talk to us here about how likely the CDC advisory panel and the director could potentially sign off on this today, and essentially how soon adults could get their boosters.
So the expectation is, the CDC's advisors will start meeting at noon. This meeting is scheduled to go until 3 o'clock with a vote at the end. And the expectation is they will vote to recommend the broad eligibility that the FDA just cleared Pfizer and Moderna for. We will be paying close attention to that discussion, though, because there was a concern about the very rare risk of myocarditis, that heart inflammation that's seen predominantly in younger men after the second dose. But again, it is so rare. So we'll be listening to see how they discuss that risk for that population. And then listening for the vote at about 3 o'clock. If all goes well, the CDC director usually signs off within hours, and then folks will be eligible.
Doctor, we mentioned that public health experts are concerned of an upcoming surge. So how much of an impact do you think these boosters will have to maybe stave off the worst, considering, and correct me if I'm wrong, it's mostly the unvaccinated who are still driving up numbers?
Lindsay, we are currently at the precipice of a winter surge. We're seeing 100,000 daily cases of COVID for 2 days running. And we know that boosters work. When we look at countries like Israel that have 75% of their adult population boosted, their statistics are very different from the U.S. They've had 0 COVID deaths for 3 weeks running. The U.S. is a long way off from that, but we can dampen and minimize the impact of the winter surge that we are on the precipice on by rolling out boosters for all.
Meg, Dr. Rochelle Walensky, the CDC director, spoke about boosters earlier this week. I want to play part of that for everybody.
When we compare rates of COVID-19 disease between those who are vaccinated with 2 doses and those who have received a booster dose, the rate of disease is markedly lower for those who received their booster shot.
What did the trial data for booster shots reveal, Meg?
Yeah, so Pfizer did a large 10,000-person study of booster doses and found that folks who got a booster shot had a 96% reduced chance of getting COVID compared with people who got 2 doses. So it essentially restores the original protection that we got from the 2 shots now that we are, 6 months out from our original vaccines. And so it's expected that Moderna would have similar efficacy. We haven't seen such a large trial from them, but the data have been really promising there.
Wow. All right. Doctor, what about mixed messaging here? Because for a while we've been hearing you should only get the booster if you're of a certain age or you have a certain high-risk job or underlying conditions. Do you worry that not as many people will go get them?
It's interesting, Lindsay, because we are seeing that the demand for boosters is actually outpacing the demand for first shots. 800,000 boosters are administered daily compared to 300,000 first shots. So we actually have to close that gap and encourage boosters for all, yes, of course, but also first-time vaccinations for those who are currently unvaccinated.
All right, Meg Terrell, Dr. Aditi Nerurkar, thank you both for starting us off.